You're in Westmead?
Yeah, I'm a Westmead. Not
Okay.
middle of nowhere. But...
I'm here in Jakarta, in Simprug, in
there you go.
assistance. So it's wonderful that we've actually swapped places, but I think Sydney's your home. I'm going to pass it over soon to you, Dr. Richard. But I didn't know how to pronounce your title because the word beginning with O is quite...
Yeah, no, it's a bit too complicated. Let's just skip the semantics. It's basically ear, nose, and throat. Dr. Tjahjano.
So ear, nose, and throat. Okay.
Ear, nose, and throat.
You're also a registrar at the hospital. What is a registrar?
The registrar is sort of like it's sort of like a training. It's a training doctor. Basically, you sort of funneled into this specific area of training. So I want to do ear, nose, and throat surgery. So this is more like head and neck, ear infections, blocked nose, and all that stuff. But I'll talk about my specialty a little bit in a bit more detail.
Well, I'm just, before I let you talk about your specialty, because I think everyone online's in anticipation to meet you and also to learn from you, Dr. Richard. I just wanted to say, I'm aware that your time today is so precious and you're coming away from your patients and from your work. So I just wanted you to know that none of us here took that for granted. We are so inspired and grateful for that. More so grateful for the legacy you've left behind in our school. I know we probably don't tell you often, but you've left a legacy for both boys and girls to know that they can achieve great things. And I just wanted to tell you that personally, Dr. Richard.
Thanks, Mr. Peter. You're making me blush. I can't see it from here.
Next door to me is Miss Alma. I don't know if you remember Miss Alma.
Yeah, no, I remember, Anna. I remember everyone, Mr. Peter. There's also Miss Monica, my chemistry teacher, Mr. Adolfo, maths teacher, Miss Marilyn. Who else is there? I'm looking
a lot of us.
Few people.
Dr. Richard, most of us are still here. So
Mr. Eric.
Yes. So they'll all get to watch this as well once their class is finished. But Miss Alma has a class, so I know she was your class head.
I'm here.
Oh, you're there, Miss Alma.
Yes.
Miss Ali, Miss Malords, Mr. Greg. Banyak yang masih di sini ya.
Yes, hi Richard.
Hello.
Hi Richard.
It's a long time. Miss, I've already lost weight. My cholesterol is normal now.
Yeah, good.
Also,
very good.
That's cool. That's why. That's the context. Miss Alma had to drag me. Miss Alma had to drag me at one time because Richard, your cholesterol is really high. You have to be more healthy. It was back in 2008 or something like that.
Yes.
Please don't call me doctor. It feels really weird. I'm just Richard.
Miss Alma, it's funny because you're online, Dr. Richard's online, but you, Miss Alma, and I are next door to each other, but not allowed to see each other.
Yes.
So this is science. Science has made this happen. Science has made this. And Dr. Richard, when you were here in Simprug, we didn't have this.
No.
Yeah, not then. Back in 2010, it wasn't this sophisticated. So science is about progress. And I think what we'll do, Miss Alma, Miss Marilyn, and all of your teachers, Dr. Richard, is we'll hand over the floor to you now, Dr. Richard, so that we don't take too much precious time from your patients. I just want to say that personally, you've cheered us up. You can see by Miss Alma forcing herself online, you can see she's cheered up. And we're all cheered up. And we again want to say your legacy continues in BINUS School Simprug. So maybe then because you're online, Miss Alma, and you are his class head in 2010, will you now pass over the floor to Dr. Richard for his speech?
Yes, please, Richard. Please
inspire
us with your story.
Yeah, okay. Thanks, Mr. Peter, for the nice introduction. It's always very nice to see all the old, I'm an alumni in May 2010. For all intents and purposes, I'm pretty ancient. And it's nice to see that there's a lot of these teachers that inspired me and taught me throughout high school and who were responsible to make me who I am right now still here. And I think that's a bit of a testament to see how much BINUS has grown and has managed to sort of inspire other people to work and to learn at the school. And I'm proud to be I'm a proud BINUsian, is the key word. And I think here in Sydney, I think I've also adopted the Australian accent. I didn't have an Australian accent before, and now I think my accent's a little bit more similar to Mr. Peter. Anyways, nostalgia aside, I think what I wanted to talk about in the next 25 minutes here is, obviously, the big thing is talking about my experience as a medical doctor in Australia, but how I want to structure my conversation with everyone is splitting about my high school and medical school experience briefly, and as the first part of the talk, and the second part of the talk is obviously talking about my experience as a medical doctor, as a junior doctor, as someone who's in the front line during the COVID-19 pandemic, because ear, nose, and throat people are one of those high risk practitioners. So I can talk through about what we did at the time when the COVID pandemic is exploding. And the last thing I want to do as well, so that you guys have a bit of better idea of what I do in my specialty, is I'll bring you across sort of like the tour of my clinic room as well. So it'll be a bit more of an interesting idea just to see sort of what medical doctor life is because medical doctor life isn't exactly like Grey's Anatomy or The Good Doctor, Dr. House. Is completely different from that. And I hope that from this talk, you guys can learn about my experiences, and hopefully inspires you to see whether medicine is a career that you may want or may not want to pursue, because it's a difficult career and might not be for everyone. So the reason why I wanted to talk a little bit about myself and my high school experience is not to ramble about my life story, but rather I recognize that you guys are in grade 10, grade 11. And this is really the time where everyone's going to focus on, which university do I want to apply? I want to go to America, Singapore, Australia. What subject do I want to apply? Are my grades good enough? It's a stressful period during high school, and it's something that I really strongly relate. And these are the message that I want to relay, because in this age of social media, where it's everything to see everyone's successes on Facebook, on Instagram, it's easy to see, this is with Dr. Richard, he's a legacy of BINUS, made everyone proud, yada, yada, yada. But in reality, when I was in high school, when I was grade 10, grade 11, I was probably just an above average student. I wasn't always smart. I don't think I'm smart. I think I'm hardworking and I try my best. But the biggest lesson here is where I am right now. A lot of it is hard work and a lot is luck. It's not because I'm that genius who's always scored ranked all the time. In fact, I think like my GPA was low 70s, 7.5, never ranked on anything. I think I did pretty good on biology with Miss Siti Mariana and business management with Miss Malords, but otherwise everything else was okay. I wasn't the greatest. My maths was disastrous. I think grade 10, grade 11, I did so badly that I nearly got kicked down to math studies because I hated maths. During one of the quizzes, I was like, Pat Yahya, what's a matrix during a quiz? And everyone obviously gave me the dirties. I'm like, what do you mean? Have you been paying attention? So I wasn't smart. I never ranked, right? And the thing is but what spurred me to sort of work harder is because when I was in grade 11, I think, I really like biology. I'm pretty chatty. So I think, medicine is probably a career that I really want to pursue. So this is the time where I'm like, it's a bit slap on my face. I'm like, okay, Richard, you got to work hard. You got to start picking up your game, stop playing games, stop hanging out with friends too much, because I wasn't a cool kid either. I was one of those who hung out at like level 5, level 6 lockers and played my Nintendo DS or PlayStation Portable instead of being social or being productive and doing my homework on time. Sorry, teachers. I know I game a lot. Miss Vivi, who was one of the Bahasa Indonesia teacher, once suspended my Nintendo DS because I was sneaking playing games in class. In short, I wasn't a model student. So, and I think what happened was like I worked really hard, but then even then I kept failing, right? Like I didn't keep scoring the scores I wanted. Never got ranking on grade 10, never got ranking grade 11. Obviously I got disappointed. I sat the SATs. I didn't score above 2000, which means I wasn't like a competitive candidate to go to like an good American university. So it was never my high, like I've never been born, I've never been raised with like high expectations. I've never really gotten good marks to begin with. And here I am, right? It's just hard I think from a lot of people's point of view, it's very hard to say, oh, what do you mean you weren't smart to begin with? You're a doctor. I'm like, yes, like I worked hard for it. But it's also the things that you have to go through a lot of failures, right? Like I've been disappointed again and again and again because I don't do well, I don't do good enough. In fact, when a grade 12, I remember that to apply to medical school in UNSW, the university I've been, and to a few good UK universities, like the University College London, to go to the medical sciences course, I need a predicted IB of 36. At the time, I got a predicted mark of 35, to the point that I had to sort of like, because I was pretty close with Miss Donna, who was my English A2 literature teacher. And it was like, oh, my marks would be borderline. So sort of like a parent teacher interview, blah, 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 blah. And after a bit of talking, managed to sort of like convince her, like, oh, can you just pump me up to 36 so I can apply for these universities? In retrospect, I'm happy to have such supportive teachers. So without that 36 mark, I wouldn't be able to apply to these courses in the first place. So a lot of it is persistence. And I think ultimately, you know, I didn't keep, even in grade 12, I didn't get like stellar marks, never ranked. Probably I was on a 78 GPA, but on IB, I think I worked really hard for my IB exam. Really, really hard. Studying every day. I was studying with the smartest student in my year, Inez Wihajo. She's also a bit of a legend. So we studied every day. So I had to like, you know, you have to motivate yourself. You got to keep pushing yourself, right? Like I need to get above 38 to get into medical school or the university that I want. So that was what kept me going. I even asked my mom, oh, mom, can I go for a maths tuition? So I really hate maths, but I really need to get like good marks so I can succeed. And luckily enough, when the IB results all came out, I got a 40 out of 45. And I was like, it was a big surprise to everyone because I was just an above average student. No one expected me to get this high of a mark. And I ended up being second. I graduated second highest in the second highest IB in the year. Obviously the highest being Inez, 42 or 43. But that was sort of like when my life started to switch upside down from someone who was never considered to be very bright, never someone who was like, oh, you know, he's pretty good, but not that good, to suddenly, he's second, he's the second highest mark in IB in 2010. And that was considered a high mark at the time because this was the second year, I believe, that BINUS ran IB course. So it was a bit of a surprise to everyone. And then I got lucky as well. I got to medical school. So I think that was a bit of a surprise to everyone and surprise to me myself as well. So I think that this short sort of like my rambling over the life story really is just to show you an example that I'm a bit of an underdog. I'm a bit of a dark horse. Like, you know, I wasn't smart to begin with. I think it was with determination, grit, perseverance, and just hard work. You get knocked back all the time, but you stand back up. And I think that's a huge part. That is a huge character building trait that were necessary for me to get to where I am. So I know I can relate to probably a lot of you who are like, oh, you know, I'm disappointed with my marks, or I'm not sure if I can get to the university or the course I want. What I want to give as an opening statement is I want to give you hope, because if me, just a barely above average student, work hard, persevere, and keep standing up from all my failures, can make it here, I think, you know, anyone can make it. Right? So I just don't want to give the perception that just because I'm a doctor, I'm automatically smart. And that's the point that I want to drill to everyone. So that's the first part. The second part is applying to medical school, and it's also a bit of a stressful part of the entire process. So I applied. Where did I apply? I think I applied to the UK through that UK system, but I only applied for medical science because at the time I was a bit disorganized and I actually missed the deadlines for all the medical school. And for medical school in Australia, because they start in February, so the deadline was more forgiving. So at the time, I already had my IB marks, and I also had to sit this thing called the UMAT, undergraduate medical admissions test, that I had to sit as part of the prerequisite. So I had to study hard as well. Because I graduated in May, I had the time to study more and sit the exam and everything. I did fairly well on the exam. That's how I got to medical school. But if you are thinking of going to medical school, you have to look at the things now. Like either you want to go to an Indonesian medical school or an Australian or UK medical school, which is largely undergraduate. I think it's important for you to really look at it right now in grade 11, because there's a lot of like prerequisites, what courses you have to sit, how many, what's the marks that you need to get, which courses you need to have for HLs, and what other tests, such as the UMAT for Australia or the UK CAT for the United Kingdom one. I think the big thing is just read early and be prepared when you apply for medical school. And when you do get an interview, you have to practice the interviews. That's one of the key things as well that a lot of people don't say. Like even in other unis that have interviews but not medicine, you have to practice interviews because they'll ask you weird and wonderful questions. So when I had my medical school interview, it was like, oh, what's your spirit animal? I was like, I don't know. I got to start thinking like 5 seconds to think, oh, what's my spirit animal? Oh, okay, I'm a monkey because of blah, 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 blah. Or the other things, oh, what do you think is, your biggest achievement to date? Or like, what do you think about, what is his stance with vaccination? And what do you think about anti-vaxxers? These were a few questions that I had asked that, like, thankfully I prepared, but not very prepared as well. And I would have benefited more if I prepared for the interviews. They try to test you. They're not going to ask you about why do you want to do medicine. That's not really the stock standard question they ask. Rather, they ask these left of field questions that forces you to think on the spot. And they want to try to tease out your personality and how much of a good fit you are for the medical school. And that's the thing to keep in mind. And that's why it's really important for you to prepare for the interviews, to know the university program back to front, because I was part of the faculty board and I actually sat on these interviews. I wasn't marking the interviews for medical students, but for prospective medical students, but I was just observing the entire process because I had to clerk the high school students, and they were all nervous and everything. So I know the exact feeling. It's a bit of a stressful time, but it's just, as long as you just knock things off one step at a time, I think you make it manageable. It's not, don't leave it to last minute. If you're thinking of medical school, think of university, think of courses just in general. It's good at grade 11, it's a good time to really think about it, sit down, talk to your friends, talk to your teachers, talk to your principal, just so that you have a bit of a clear pathway. Because I think being prepared is so important, especially on this current competitive landscape, that you want to stand out as much as possible. And standing out is not just marks, but other things that you do as well outside, outside that you do in school. Because these are a lot of the things that I think I was fortunate that I've learned, a lot of these soft skills that aren't marked, like, chemistry test, maths test, there's a mark, but there's other things as well that people, that are better predictors for success as well as, for example, how well you get along with people, how good you are in speaking in front of people, how confident you are, and how much you can stand your ground. So a lot of these things, these are the soft skills that I think the extracurricular in BINUS really helped me. I did like Habitat for Humanity. I had to talk to a lot of people. I did Saman dancing when I was high school. I did badminton. So a lot of these things make me well balanced. And I think the most important thing is not just excel academically, but be a very well balanced person. I think that makes you stand out, because that means that you can balance your time quite well. You can focus on your studies, you can focus on other things, and you can also still enjoy life at the same time. And enjoying life, I think, is really important, particularly when you get to my stage as a doctor. That's the first part. That's a little bit of a rambling. Being a bit of in medical school, I think it's medical school is a bit of an interesting time. I really enjoyed my time in medical school. In the first 2 years, it's sort of like a pre-clinical year. So you do like really hard hitting biology. So if anyone does biology here, you know how like we spend a week or 2 weeks talking about translation, transcription, or like in chemistry, you go through a week talking about oxidation, reduction, and organic chemistry. These lectures go boom, smack in like one lecture, and then they expect you to understand. So I guess it's a bit harder than you usual as a medical student. It's a bit harder. it's a bit harder than your usual high school fare because they don't spoon feed you the information. They give you the information, but they sort of give you that responsibility to learn on your own. And that's why I think the IB program is good, because it forces you to it teaches you how to critically think. And the IB curriculum is a very broad curriculum that it does really prepare you for university. So I think that even the first year, really complex genetic stuff, transcription, translation, all these medical student topics, fortunately I've covered in IB. So I was a bit more prepared. So I wasn't as caught off guard. The other thing as well is lectures are pretty extensive compared to, people who do business or arts or any media or any other things. You expect to be there at uni 5 days a week. So you do 9 to 5 lectures, practicals, anatomy, and it's a bit more, it's busier. So you gotta have that expectation that, like all the other friends are having fun because they only have 2 or 3 hours lectures a day and go home and go shopping or travel the place. You're studying. And the studying isn't too bad, to be honest. I didn't find medical school terribly hard. You just needed to be consistent and you need to know what you need to do with your time. And in university, it also opens up a lot of opportunities as well to do other things outside of just academics. I think what I did as well was doing medical reviews, which is the drama stage production, which I thought was very helpful in building my confidence. If I didn't do a few of the things that I did at university, I don't think I'd have the confidence really to speak in front of multiple people right now. I did a lot of leadership stuff as well. I was the president of the medical society at one time. And that really built sort of like my communication skills and being able to manage small organizations. These are all the things that I think are translatable even as a doctor or whatever you're doing in the future. So I think I would highly encourage you to engage not only in academics, but also in extracurriculars as well, whether in high school and also at university. Now, talking about my experience as a medical doctor. So I've been a doctor for about 4 years now because my medical degree was about 6 years. Being a doctor is pretty busy. It's not your expected 9 to 5 job. So don't expect it to be a 9 to 5 Monday to Friday job because it can get quite tough. So the training would be different if you train in Indonesia, in Singapore, and in Australia. But I can give you an account of how Australian training is like. So in Australia, the first 2 years that you do is what you call internship residency, junior doctor years. So you do 10 weekly rotations in different specialties, medical, surgical, or critical care, or emergency. So for example, in my first year of internship, I had to do a general surgical term, so abdominal surgery, like in the tummy over here, for about 20 weeks. I did cancer medicine for about 10 weeks. I did emergency for 10 weeks, and I did after hours. So like I do afternoon shifts or night shifts for about 10 weeks. So that's what you get to do. Like at the beginning, you think, oh, you're doctor, you sit here. What's your understanding of a doctor? Most of the time, you go to a clinic, you sit down, see a doctor, have a chat, they give you prescription. That's what you see in the clinic setting. But being a doctor is much more than that. We split our clinical duties into inpatient, so patients that stay in hospital, outpatients, so clinic patients that we see that not in hospital, but they just come in and see you for a 10, 15-minute consultation, which I'm doing right now. And number three is sort of administrative. And as a junior doctor, you are a big paper pusher. You are a secretary. So basically, a lot of the things you do is the registrar. So people on my level who's a bit more senior, they see the patients and they make plans. All I do is I wheel a big computer as they start chatting with the patient. I type stuff. Oh yeah, okay, the patient feels well. Oh, the patient's tummy looks like this. Oh, this patient needs an X-ray. Oh, these are the patient's blood tests. And then maybe this patient needs to have an X-ray. This patient needs a CT scan. I need to call another person's specialty. So the registrar just makes a plan. Me, the paper pusher, makes all the phone calls, starts going to offices and beg for things to happen. So basically, you're the secretary. You make sure that the documentation's in place. You make sure all the paperwork's done. You make all the administrative phone calls. It's great, but also it can get a little bit tiring. You don't do actual medicine most of the time as a junior doctor because you're there to learn. You don't really know what it is to be a doctor. You go through medical school, but the things that they teach in medical school can be quite different from actual practice. So that's why That's why you do the you do the intern role, where most of the time you don't really do most of the big clinical decision making, but you only make the small clinical decision making, and mostly do paperwork. But you slowly learn from that process, and it's a very safe and supportive way of you doing it. Because, you know, when you're a doctor, you're dealing with people's lives. It can get a little bit daunting, can get a little bit scary. So that creates a bit of a safe environment where you can slowly learn from your registrars and your bosses and how to be a doctor, how to manage patients, and how to communicate. There's a lot of different things in medicine. In medicine, it's not just you have this problem, this is how we fix it. You got to consider a lot of other things as well, such as how the disease is impacting the patient's life or the family's life, or how you got to quell their anxieties. If they live from far away, you need to learn how to accommodate seeing the patients to make sure they followed up consistently. So there's a lot of factors coming into play the more senior that you go. But the first 2 years is you're a bit of a paper pusher, you're a secretary, you're writing forms. The reason why, I think I found out within the first 2 years that the reason why doctors' handwriting is so ugly is because you have to do so much paperwork at a short amount of time, and you're like, nah, I'm not spending my time having nice handwriting. So it's like, here you go. Oh, here's the script. Here you go. Oh, that's the script. Here you go. Right? You don't want to waste time, because sometimes writing a medical script can take 2 to 3 minutes, and that's 2 to 3 minutes of your time that you can see other patients, that you can do other things, make some phone calls. So it starts accumulating. And especially when I was a junior doctor in my first year, I wouldn't eat. I would forget to pee. I'd forget to eat. Like I'd literally wake up at 5:30, get to work at 7, go hard out in a busy day, literally won't have time to eat until 6, 7 p.m. And you're like, oh, it's 7 p.m. Okay, I'm all done. Oh man, I'm hungry. Oh, I need to pee. Oh, you realize at the beginning, it just gets pretty hard out because you're so busy and you're still unused to the system. Otherwise, you get really tired and you get really flat out. But it's all very rewarding work, because you see like the big differences that you make in people's lives, even as a junior doctor, right? Just being there for your patients, not making the management plan, but rather instituting. You're the one that actually makes the plan happen, and you see the patient getting better. I think that's a really satisfying thing to see. The other good thing that I really like about medicine as well is that sort of like that continuity of care. That's the term that we use. So we see a patient, they go to hospital, we make them better, we follow them up, in 3 months, in whatever months, and we see them getting better. That's fantastic. I think that's one of the most rewarding parts in hospital. But it's a bit of a double-edged sword as well, because sometimes, you see a patient, you treat them to the best of your abilities, but then they're not getting better. And that saddens me sometimes, right? Like you've tried your best, but you can't help them. Something like one of the examples was there was a cancer patient that I saw like in 2017, got better. We treated him here and there. I'll see him in clinic. It's great. But then 1 year later, I was on night shift, 3 a.m., getting called to see a deteriorating patient, and I see him like literally dying in front of my eyes. So that's sort of like, it's one of those like really career defining moments that sort of make you question. So like, oh, this is a doctor's life. Like, yes, you're making people's lives better, but also at the same time, you have to you see all these sort of like sad stories and all these things, and you sort of like become emotionally invested in your patients. And these are like, the beauty and also the dark part of medicine as well, that I think is what makes medicine such a rewarding career for me. And I know that medicine may or may not be a career for everyone, because it's busy. Right now I'm a registrar, so that means I'm sort of funneled into sort of this pathway to become an ENT surgeon. So what an ENT surgeon is you manage disease of the ears, nose, and the throat. And most of the time when you think, oh, you manage like pretty, ear infections, blocked nose. It's not glamorous at all, but we actually do quite a fair bit aside from the benign quality of life work, such as ear infections and all that stuff. It's a wide specialty, and the big thing that I'm really into is head and neck cancers. We see a lot of head and neck cancers here, and we do big operations, 12, 13 hours, like really, because they need to have like half their face like cancer taken out, all really cool, great and wonderful things. A good part of ENTs, you see, it's like a bit of a cradle to grave specialty. We see babies with their breathing problems or their nose or ear problems from 0-day-old that need surgery up to 100-year-old with skin cancer in the head and neck that you need to cut out. So it's a pretty cool specialty. But it's a cool specialty, but because the thing is, you got to really go up close and personal to people's mouth and nose and throat. And in COVID, as we all know, COVID is spread through respiratory aerosol droplets. So if you sneeze, you cough, that's how you spread COVID. And I literally, if this is a person's face here, I literally come really close and really have a good look inside someone's nose. So it's an absolute recipe for me to get COVID. So that's why ENT last year was such a volatile specialty to be working in the field. So what we had to do, right, we had to put on an N95 mask, a helmet, like an entire protective environment, a protective gown to see patients. It was very restricting. And then we have all these examinations that we call, that can generate aerosol. So we need to drain pus or abscess from someone's back of the throat or the nose, stick a needle, pop a knife on someone's throat, and that creates aerosols. So you have to go into like the specific isolation room with negative pressure, so that when aerosol gets flushed out, they go into this negative pressure vent, so they don't circulate in the room anymore. So it makes a lot of things much harder. Things that'll take 10 minutes. I'll have to like put my astronaut suit, wash my hands for about 5 to 10 minutes every single time I take things off. So it's quite interesting. So that meant like, the things that we can do is limited. Every time we go to operating theaters, because if we operate on someone and they produce aerosols, for instance, like doing a throat operation, we have to use all these like halo masks, put in a negative pressure room, wear an astronaut suit. It's crazy. Like something that would take 30 minutes would take over an hour. And it's scary because we are very vulnerable just because we go into people's faces. So that was pretty interesting. Unfortunately, in Australia, COVID was very well controlled. So now I don't need to wear a mask anymore, which is nice. But it was very interesting. You see all these really sick patients in COVID, and because it's respiratory tract, right? Ear, nose, and throat. Throat is connected to the lungs. So we also get involved with COVID patients as well, if they need an extra breathing tube in the neck or all that stuff. So we have to manage it. So you get quite involved in COVID last year, which is fortunately now getting better. But on a work basis right now, it gets pretty busy. Right now as a registrar, I work about 7 a.m. to 4:30 p.m. every 4:30 p.m. about probably 6 days a week. And I have to do 1 in 2 on call. And what on call is I can be called anytime, 1 a.m., 2 a.m. And if I have to go to hospital, I have to come to hospital. So I do every other day I'm on call, and every other weekend I'm also on call, which means I work 6 days 1 week. Like last week, I only had Sunday off. And this week I work Monday to Sunday, and I'll continue on until next Saturday without a break. So that's pretty busy. Like you get pretty slow. You go home, I'm like, oh, I don't want to do anything anymore.
Sorry, Dr. Richard. Very sorry, but the time is a little, we're already a little out of time.
Talked a little bit too much, but yeah.
No, it was very interesting. So thank you so much, Dr. Richard, for providing us with such a motivational talk and insight regarding how you started your medical career, advice, and how some of us who are interested or passionate in pursuing a degree in science, specifically medicine, could endeavor to do the same. Now we would like to call upon Mr. Ardolfo to say some messages, and we will present the certificate.
You're still muted, Mr. Ardolfo.
Mr. Adolfo, you are muted.
All right, Dr. Richard, thank you very much for that insightful message and inspiring story on how you made it as one among our top students in BINUS. I know second is still a very high thing, and noting that Ines was there. So thank you very much for that. Many would say
she was unbeatable.
Many would say that if you're an average student, you remain to be average. Actually, you have proven them wrong, and that's why I was so happy when you came up with that kind of story. It is one thing for students to know. that just because you're an average, you cannot make it. You can make it. Your frustrations and eventual successful journey towards a very promising career as a medical doctor, a frontliner in this pandemic, is one story that we will always remember and cherish, Dr. Richard. Thank you for that. And as an appreciation of your contribution, we'd like to give you a certificate showing how huge our thank yous to you for your time and for the inspiring message. Thank you. And may I call on Nadia to read the certificate and ask for a few more words from you later on after reading. Nadia, can you please read?
Yes, so we would like to present the certificate of appreciation to Dr. Richard Tjahjano for sharing his valuable knowledge and insight as a guest speaker to the recently concluded Science Fun Day in 2021. Now, may we call upon Ms. Marilyn to say some parting words.
Thank you so much, Dr. Richard. Can you see me? Okay, thank you so much.
Yes, I can see you, Ms. Marilyn.
We're very proud to have you as our guest speaker. I know everyone in BINUS are very excited to see you, especially the teachers, your former teachers like Miss Alma, Miss Monica, Miss Mallards, and everyone here. We are very excited, and also Miss Bibi, she actually messaged me, and we are thankful to have you as our guest speaker. Thank you for your wonderful messages and inspiration to our students, and your story will remain remarkable one to all our BP students. Thank you so much for your valuable time and effort.
And by the way, Richard, regards to Raymond and Ryan, yeah, your brothers.
Yeah, exactly. We're all BINUS graduates.
Yeah, Raymond, can you? Sorry, Raymond. Richard, can you give us your parting words, please?
Oh, yeah. No. So again, look, thanks very much for having me here after a decade of missing in action. Look, I hope that my message has sort of like, hammered down home the fact that, even if you're average, if you work hard enough, you persevere, and you don't give up. And I think that's the big thing, because life is always going to throw challenges at you. Never give up. If you want it bad enough, you'll get it. And I hope that you've enjoyed my talk, even though I've talked over time.
Thank you so much.
Thank you, Dr. Richard.